Hello and welcome to another episode of Med Madness. Today we're diving into an important topic for medical students and healthcare professionals alike, Wolff-Parkinson-White syndrome, commonly known as WPW syndrome. Understanding WPW is crucial because it involves complex cardiac arrhythmias that can have significant clinical implications. In this episode, we'll cover the basics of WPW syndrome, its pathophysiology, symptoms, diagnosis, treatment options, and present a real-world case study to bring these concepts to life. What is this condition? Wolff-Parkinson-White syndrome is a condition characterized by an abnormal electrical pathway in the heart, known as an accessory pathway or bundle of Kent. This pathway allows electrical impulses to bypass the normal route through the atrioventricular or AV node, leading to early ventricular depolarization. The presence of this accessory pathway can cause various types of tachyarrhythmias. Causes and risk factors. The exact cause of WPW syndrome is often unknown, but it can be congenital, meaning individuals are born with this accessory pathway. Risk factors include a family history of WPW and other congenital heart defects. Pathophysiology. In WPW syndrome, the accessory pathway conducts depolarization directly from the atria to the ventricles, bypassing the AV node. This mixed ventricular depolarization appears on an ECG as a short PR interval, a slurred upstroke of the QRS complex known as a delta wave and a widened QRS complex. Now let's talk about the symptoms and clinical presentation. Patients with WPW syndrome may experience palpitations, dizziness, shortness of breath, chest pain, and in some cases, syncope or fainting. The condition typically presents with episodes of rapid heart rate, which can vary in frequency and duration. Some patients may remain asymptomatic and only discover their condition during routine ECGs. Next, let's move on to the diagnosis. The primary tool for diagnosing WPW syndrome is an electrocardiogram, or ECG. Key findings include a short PR interval, delta wave, and widened QRS complex. Continuous ECG monitoring with a Holter monitor can help capture intermittent arrhythmias. An electrophysiological study, or EPS, is used to precisely locate the accessory pathway and assess its properties. Next, let's discuss the management and treatment options for WPW syndrome. Medical and surgical interventions are available. For stable patients with pre-excited atrial fibrillation, procainamide is preferred. Avoid AV node blocking agents as they can worsen the condition. Synchronized cardioversion is indicated for hemodynamically unstable patients. A definitive treatment option is catheter ablation, where the accessory pathway is ablated, preventing it from conducting electrical impulses. Patients are advised to avoid stimulants such as caffeine and alcohol, manage stress, and maintain a healthy lifestyle to reduce the frequency of arrhythmias. Now let's present a brief case study to illustrate a real-world example. Let's consider a 25-year-old male who presents with palpitations and a rapid heart rate. His ECG shows a short PR interval and a delta wave indicating WPW syndrome. After further evaluation, he is diagnosed with atrioventricular reentrant tachycardia, or AVRT. He is treated with vagal maneuvers and adenosine, which successfully terminate the arrhythmia and restore normal sinus rhythm. The patient is then referred for an electrophysiological study which confirms the presence of an accessory pathway. A catheter ablation is performed, resulting in the successful elimination of the pathway and preventing future episodes. To summarize, WPW syndrome is a condition characterized by an accessory pathway that can lead to various types of tachyarrhythmias. Early diagnosis and appropriate management are crucial to prevent complications such as ventricular fibrillation. Remember, engaging with our pre- and post-podcast quizzes can help reinforce your understanding of this topic. Thank you for tuning into Med Madness. Stay curious and keep learning.